Imagine you're a nurse in a busy emergency department. You've settled your other patients and you go to a new patient's room that the triage nurse just brought back. She's sitting on the bed, kind of staring off into space. She looks disheveled. She's wringing her hands. You call her by your name that you saw on the chart and you ask, "How are you doing?" Nothing, no response. So you call her name again and ask, "Is there anything I can help you with? What's going on?" She finally looks up at you, locks eyes with you, and then you see her eyes widen with rage. She explodes off the bed, and before you can even react, she lands two punches to your neck and to your cheek. She grabs your scrub top and she starts pushing you out of the room, and she's yelling things that you can't even tell what they are. Spits flying. You don't know what's happening. You're like, man, this is out of control. So you regain some composure and you grab onto her and you start pushing back like, I need to contain this. This is getting out of hand. I should, man, there's other patients around. I don't know what's going to happen. So you push back, you push her back into the room. And of course, in pushing her back, her legs connect with the gurney and she kind of falls back onto the gurney. And you try to control the top half of her body on to the gurney. And she manages to grab your arm and she pulls towards you. And then you feel her teeth biting into your wrist. You feel some pressure and it's starting to get pretty hard now. And you yell, "Stop." You yell, "Stop." She doesn't. So you take your free hand and you slap her on the face. It stops the bite for about 2 seconds or so. But then the bite is there again. This time it's harder. You yell at her, "Stop." And you slap her again. And finally, this time she actually lets go. She lets go of your arm. And this time you've got techs, you've got security, you got fellow nurses coming into the room because they heard the commotion and they help control and restrain the patient. So the situation is done. The patient's taken care of. You go to the bathroom, you take a look in the mirror. You see red spots on your neck and on your face, starting to swell a little bit. You go get some ice, you put it on your face. You go and finish your shift. You write the incident report, you go home, and you decompress a little bit. The next day, the manager calls you and says that you're being put on paid administrative leave. Not because of the violent episode, but because of what you did. You left a red mark on the patient. That's abuse. Even a coworker said that you were too aggressive. And then 2 days later, HR calls you. You're terminated for patient abuse. Nobody heard your side of the story, only what you read in the report. 25 years as an emergency nurse in that one department. Done. With a snap of a finger. Now I want you to hold this situation because it's a hypothetical. It's a composite of events that are happening in emergency departments and behavioral health units and med-surg units in hospitals throughout the country. Happens every day. And this is what this episode is about. Self-defense in healthcare. Now the question that we want to hold as we go through this episode, was the nurse wrong for how they responded in this situation? Welcome back to the Black Belt Violence Prevention Podcast. I'm Bill Schuler, and for the last 14 years, I've been trying to understand and prevent violence in the healthcare space. Now, you may be used to the Black Belt Nurse Podcast, but I updated the name to more accurately reflect the topic the podcast is based on. Now, a quick disclaimer before we start. I'm not an attorney. Nothing in this episode is legal or medical advice. None of what we talk about reflects the opinions of my employer or volunteer organizations, past, present, or future. This is episode 12, and it's a big one, self-defense in the healthcare setting. Here's the problem that we're really not admitting to. Healthcare workers, at least in the United States, are 4 to 5 times more likely to be injured by workplace violence than any other workers in the private industry. Caregivers are trained to absorb difficult behavior with compassion, which is the right instinct. We want caregivers to do that. But let's say that happens 95% of the time. What about the other 5%, where things go awry, where violence actually happens? Do we have a plan for that? Do we have a plan for if the situation is appropriate for somebody to respond to violence with violence? Now, typically, what hospitals have are zero tolerance policies, which pretty much are a blanket statement for we do not accept violence. We do not tolerate violence. We have zero tolerance for violence. But that creates a conundrum because you're saying to a patient, we have zero tolerance for violence that you are committing to us. But isn't that policy also applicable to, and often it is, that if a caregiver responds to violence with violence, that the zero tolerance policy applies to them as well? Or there's even situations where staff or even our security officers are not even allowed to intervene physically. And the last thing we need is for a caregiver to be in the middle of a situation and having to ask themselves, if I defend myself, will I lose my job? That should not be happening at all. So this is where we need a plan for situations like these where it might be appropriate for a caregiver to defend themselves. So the big question is, can healthcare workers defend themselves? The answer to that, of course, is yes. Yes, you can legally defend yourself. Now, there's really not precedent, meaning that there's not case law, meaning that there hasn't been really well decided legal cases where a jury has said, or even a judge has said, in the healthcare space, if a caregiver has to defend themselves, yes, you can. And the hospital is wrong for terminating that caregiver. We don't really have that precedent because, from what I know and what I've experienced, those cases settle out of court, which is probably a good thing because the last thing you would want is a situation like the one we talked about in the opening to go before a 12-person jury and then for them to hear that, to be put in that kind of situation, to understand that caregivers encounter these situations on the daily, and yet you're going to discipline or you're going to fire them for trying to protect their own life or even the life of a coworker. So we really don't have much precedent. However, there have been some recent legal cases that are not in healthcare. Now, the first one I'm going to highlight here is called Ray versus Walmart stores. And this happened in the state of Utah. And in this case, employees were terminated for defending themselves against a violent customer, despite the company policy of you withdraw and you call police. So they sued for wrongful discharge, and the court sided with the employees, saying that the public policy favoring self-defense outweighs an employer's zero tolerance interest, provided that two conditions hold: that the employees genuinely believed that they faced imminent, serious bodily harm or death, and two, there was no realistic ability to withdraw from the situation. So that is one case. Now, another one was just decided early in 2026, and that is from the state of Colorado. And that is Moreno versus Circle K stores. Same concept where an employee was terminated for using self-defense. Now, the argument is not whether that self-defense was appropriate. The argument is, can an employee use self-defense and it be wrong for them to be terminated if they do use self-defense? So the Colorado Supreme Court said the same thing. They said, yes, self-defense is public policy. It can be used, and an employer should not fire somebody for actually using it. This goes back to even before Colorado was formed as a state. It's also sometimes known as common law. It's in the state constitution. It's in state statute. Employees have the right to defend themselves if they need to. And so one of the justices even said that right does not go away just because you clock into work. It follows you to work, it follows you at work, and on the way home from work. So what is self-defense. Self-defense, if you had to describe it, is you fighting back against somebody who's trying to hurt, maim, or even kill you. And you can do this for even somebody else. It doesn't have to be just you. If you're going to decide, is it justifiable self-defense? There are things that you have to look at. And there's about 4 things. Now, I'm pulling this from the Oregon statute, and it's Oregon Revised Statute, or ORS 161.209. And that's testing for the reasonable belief that force is necessary in a degree that's reasonably necessary. So one, you have to believe that the threat is happening now, or it's about to. It's not one of these, oh, they could get violent later. It's happening or it's imminent. You also have to look at proportionality. Is the force that the person used, or maybe myself, I'll use myself as an example, is the force that I used, does it fit the threat? Is it proportional? Meaning that the slap ended the assault and it's done. Or let's say the bite ended and the nurse keeps going and punches the patient in the face and keeps punching the patient in the face. Is that proportional? Absolutely not. Now, with proportionality, you also have to look at body size. Is the aggressor 300 pounds, 6'4", and the person trying to defend themselves is 5 foot and 130 pounds? You might have to use more force. And there might be a situation where deadly force is appropriate and necessary, unfortunately. The third test is reasonableness. You have to look at the subject themselves. What did they believe at the time was happening and what they needed to do? The objective part of this is, what would a reasonable, similarly trained person believe at the same time, and would they maybe have acted similarly? And the fourth thing for self-defense essentially to be justified is you can't be the initial aggressor. However, let's say you are the initial aggressor and then you signal and you actually back down. You're like, okay, we're done. We're cool. And then the other person comes after you now. That right to self-defense can be regained. So if we look at the Utah law with Ray versus Walmart stores, and then Colorado with Moreno versus Circle K stores, the right of self-defense follows you from home to work and back. Self-defense outweighs the employer's zero tolerance policy when that 2-part test is met. And in Oregon, we have to train healthcare staff in self-defense. You have to train them what it is, what it isn't. You have to train them what is proportional. You have to train what is acceptable within a behavioral management plan. And it mandates that we train to this. But it also says to the employer, you cannot retaliate or you cannot sanction an employee for using it appropriately. So you've got these 3 points of data. Now, just with Utah and Colorado alone, those are 2 points of data. Those are not a trend. But if we also consider that more states are adding violence prevention education requirements to state law, there's about 20 now. The trend is going towards that, yes, violence is an issue. We need to train to it. And we should be defining, is self-defense appropriate and defensible and justifiable in the healthcare space? So when an event happens, like in the situation that we started with, we need to do the investigation afterwards. So let's say the event happens, people are taken care of, the caregiver is taken care of, the patient is taken care of, management knows the reports have been written, now the investigation needs to start. How is this going to happen? How is this going to happen in a fair way? We need to look at the actions of the employee or the caregiver, and we need to look at the actions of the employer. We need to look at them both. In fact, I would say we need to scrutinize the action or even the inaction of the employer just as much, if not more, than we do for the employee. Now, I've came up with a list of questions that we should be asking when we're evaluating the actions of the employee or the caregiver. and over 60 questions of what we should be asking the employer side of it. But to start, let's do a fair analysis of what the caregiver, what their actions were. So let's look at their immediate welfare. Have we offered them physical care? Have we assessed their psychological state? Are we treating them as a witness, or are we treating them as a suspect? How are we framing our investigation? Are we going in assuming they're guilty because we didn't like what they did? Trust me, healthcare leaders sometimes really do not like when they hear that a caregiver responded to violence with violence, and they've somewhat made up their minds already. We need to look at the facts. We need to look at the type of force. Was it striking, blocking, kicking, hitting, slapping? Were there witnesses who looked and watched? Do we have video? Do we have the cameras in the hallways that caught it? Most of the time, those don't have audio. Do we have body cam footage from the security officers who've arrived? Granted, that usually includes audio. Heck, some places probably have body-worn cameras on clinical staff too. That's becoming a bigger trend. Has that all been preserved? Have we looked at what was the staffing matrix like? Was there enough staff? Was this nurse working down the hall alone at night? Was there enough help? Now you look at the actual self-defense situation. Was the attack imminent? Was it happening? Was the proportion of their action proportional to the attack? We need to also assess when the attack was done. Did we retreat? Did we stop when the threat was done? We should also look at the training of the employee. Were they trained in de-escalation? Were they also trained to realize when de-escalation is not working? Did they even have a chance to try to de-escalate? Did they receive any training on de-escalation? Did they receive training on physical defense skills? Did they receive training on breakaway techniques? How often were they trained in those? Was it one time 8 years ago? Was it one time a year? Is it multiple times a year? Because in my opinion, we don't train enough on the physical skills. Once a year is not enough to develop muscle memory. Now, I'm a 4th degree black belt. I've been training for 16 years. I am well aware that I can get into a situation where, despite my training, despite the muscle memory that I have, and even from training in a violence prevention course for 4 years, I know that sometimes those skills will fail me. I might get caught off guard. The situation might not present itself where I can actually use the technique. Was the technique that was used, was it adequate for the setting? Is the training that we provide staff adequate for the clinical setting that they're in? Because we know that emergency department staff, behavioral health staff might need more training and more skills than, let's say, pediatrics or mother baby or the neonatal ICU. We tailor our training to the needs of the employees. Next, we need to look at, did they have an opportunity to withdraw? Was there a safe, realistic path to retreat? Did we look at the space that this event happened in? Was there only one exit? Was that exit blocked? Did the assailant or the aggressor get in front of the exit and block? Like our situation. Did the patient prevent the caregiver from leaving by grabbing onto them? Was the caregiver cornered on purpose or on accident? Did they even feel like they had an opportunity to escape? And lastly, we should look at the intent and the consistency of the story. Was the response that the caregiver did, was it reflexive? Meaning that they didn't have time to critically think or logically think of what they were doing and the slap happens as a reflex. Or maybe their martial arts training kicked in and they threw an elbow or a punch or a kick. Did they mean to hurt the person? Did the threat stop and then they go back in and retaliate? Does the account match the evidence? Does the story match all the information that we're gathering? So those are some critical questions that need to be asked when we're assessing the behavior and the situation, especially involving the caregiver. Now, moving on, we need to also, like I said, even more closely scrutinize the organization in these type of events. Now, one of the reasons why is because the organization has a duty to provide a workplace that is free from known hazards. And we know in healthcare, violence and assault and battery is a real and recognized hazard. And essentially what OSHA's general duty clause says, you have to provide a workplace that is free of recognized hazards, including violence. Now, OSHA does not have anything on the books that says that an organization has to have a violence prevention program, policy, or training. They've been trying to, for quite a few years, to make a general rule that healthcare has to have and provide violence prevention training, but that has not been made a rule yet. Now, if you look at regulatory and accreditation bodies like the Joint Commission, they do have rules that say you must have a violence prevention program. It needs to have a leader. You need to look at data. You need to have people report. They have rules. And even though their rules are changing, those are staying. And you have to investigate events that happen. Those higher level events that turn into sentinel events, which could be sexual assault and abuse events, and somebody's murdered on property, or let's say a workplace violence event is bad enough, and it could be a patient. It could be happening to a caregiver. It could happening to a visitor or a vendor. Anybody who's on the property of that hospital or that healthcare institution is responsible for the safety. And if something happens where that victim needs surgery or is hospitalized, goes to the ICU, suffers permanent harm, that is a sentinel event and must be reviewed. So that's part of why a hospital or a healthcare organization needs to do a proper and thorough investigation. So some of the things that need to be looked at is, was there foreseeability in this situation? Did the patient have a known diagnosis that precludes them to be violent? Did they have prior violent behavior? And if they did, how was that risk passed along to the caregivers, to the team? Was there an actual care plan in place to help manage this patient and their violent behavior, or even their visitors? Was that even communicated to the caregiver? We should also look at the environment and staffing. Did security respond in a timely manner? Are there panic buttons that we can wear on the badge or that are stationary that can be pressed on a wall? Did those work as designed? Is the design of the room where people cannot see around corners? Was the caregiver working alone? Some of these, they seem like basic questions, but they should be asked. We should also look at policy. Does your policy clearly define if a caregiver can use self-defense or not? Does it define what a caregiver can use or not? Or does it just say there's zero tolerance? Just that blanket statement. Does it say you can't touch a patient? You shall not defend yourself. If a policy says you cannot defend yourself, I think that's putting the organization at risk. And the overall question that should guide the entire investigation when looking from the organizational side is, why was this caregiver in a position where physical self-defense became necessary in the first place? What are all the factors adding up to this? That is the question that needs to be in the back of the mind. Another topic to consider is, does the state recognize wrongful discharge for self-defense? So, like if you're in Colorado or Utah, or maybe even Oregon, is it more likely that, yes, this is a state where they've settled, the state Supreme Court has settled that, yes, an employee can use self-defense, and it's a matter of public policy. Now, I would say even if you don't live in those states, it should apply, because if a case went to a civil trial, they're going to look at these two cases. And even before a decision is made, let's say there's nursing leadership, physician leadership, you've got risk management, you've got patient safety, you got executives involved. Did legal counsel take a look at this before you made a decision? Did the organization at the outset of this event say, we are not going to make any hasty decisions? For 48 hours, there are no employment decisions being made. We are going to take our time and investigate this as thoroughly as we can before we make any type of decisions regarding employment status, being put on paid administrative leave, entering a disciplinary process, starting abuse allegation investigations. Another topic that should be reviewed is documentation and fairness. Are the organization's own failures documented with the same rigor as the caregiver's actions? So if this has happened in the past, have we kept record of the investigations? Has this been happening on the same unit? Has it happened multiple times? Are we learning from each event? Are we putting things in place to prevent the next event? Now, when we do an investigation and it's complete, we come up with our solutions or we come up with our decisions, are we communicating that back to the employee? Are we being fair to the employee who was involved? Are we being a learning organization and communicating our learnings to all the other employees? And the big key is, are we making positive change? Have we looked at benchmarking data? What are other hospitals doing? What are they experiencing? What are their workplace violence levels looking at? What are their injuries per 1,000 employees or 1,000 FTEs? How are we comparing with OSHA and NIOSH data? What changes are we making? So I built about 62 questions for analysis of the organization. It's pretty in depth. And maybe, in my experience, maybe about a third of them actually get asked. So what are some ways that we can avoid the legal system with this? The continuation of the nurse's story is that the nurse just doesn't feel good about getting fired for defending herself. And she sits with it for a while. She consults with a lawyer after somebody suggests that she should. And they think, it sounds like you decided to or tried to defend yourself and they just fired you for it. And then so lawsuit is filed in civil court and depositions are taken, documents are reviewed, requested and reviewed. And then it comes close to the court date and it gets settled. The nurse is paid some money, not enough to retire on, but enough money to make the case go away. And this is probably how it often operates, is they get settled out of court. But how could you stay out of court? One thing is to implement a just culture type system or algorithm for reviewing events like this. It doesn't have to be necessarily self-defense events, but it could be a way of systematically and consistently and reliably reviewing these workplace violence events. So just culture, if you don't know what just culture is, it's a way of evaluating the actions of both involved parties, the organization, and in this case, the employee. It's an accountability algorithm. Where did the employee have accountability and where does the organization have accountability? In this case, I think a just culture like algorithm could really help. And if you use it, I think it could really help stay out of the courtroom. Why? quite a few things here. It's a standardized tool. The analysis isn't improvised each time. You have the questions you need to ask. You have an algorithm that helps you decide what the outcomes should be, how to support the employee, what needs to happen next with the employee, what needs to happen with the organization. It decreases variation. The outcomes don't depend on which manager is on shift or which leader is on call or in charge. It forces the right questions every time for both sides of the incident. It standardizes fairness, both for the employee and for the organization. It can help guide next steps for both parties, and it's not just about discipline. And ultimately, it decreases risk. It decreases legal risk, financial risk, reputational risk. Now, I've developed a Just Culture-like guide, and I call it the Violent Encounter Decision Guide. And right now, I'm trying to pilot it with a small group of healthcare leaders or even organizations. So if you are interested in piloting it, it's about 30 minutes of your time, walking you through it, getting your feedback. You can reach out through the website for early access. And really, when we look at it, why should an organization use something like a Just Culture-like algorithm? Or why should we review self-defense situations in a different way? Well, according to the 2026 NSI Retention and RN Staffing Report, it's about $60,000 to replace one bedside nurse. And it costs hospitals about $3.9 to $6.2 million annually per hospital in RN turnover alone. Now, this is just RNs. This is not talking about CNAs or techs or any other employee who could be involved in a workplace violence event or a self-defense event. And if you look at it from a regulatory accreditation, there are more rules being put on the books that say you must have some sort of plan for addressing workplace violence. The Joint Commission's new National Performance Goal 2A still requires that workplace violence programs have to be implemented in an accredited hospital. And they are also keeping their sentinel event types that address sexual abuse and assault, as well as workplace violence. And really, it also goes both ways. The general duty clause applies if a policy leaves staff no lawful way to protect themselves. And really, if we're going to be realistic about it, it's not like from this podcast that everything's going to change. And yes, I'm going to be able to defend myself and the employer's going to understand and they're going to go to bat for me and they're going to use this violent encounter decision guide. Let's be realistic. It doesn't change that fast. We still have fairly thin case law. There's a clear precedent that exists, but it's only in a couple states and it's not healthcare specific. When we look at workplace violence events, including self-defense events, there's a huge risk of hindsight bias. The question of was there a path to retreat is easier to answer in hindsight after the fact by somebody else who wasn't there than the person who was in it mid-assault. And you've also got complexity factors. Our patients have dementia. Sometimes they are having a psychiatric episode. Sometimes they're intoxicated by substance use or alcohol, and they might not be responsible for their behavior. And it creates a slightly different environment than somebody who knows better. But the question remains, if somebody is trying to hurt me, even though they don't know what they're doing is wrong, can I still defend myself? That creates a conundrum. I'll tell of a scenario that happened to me. Now, I don't remember the exact details, but I do remember this. I had an elderly gentleman who we knew had dementia, and he was confused and he was wandering in the halls. And I approached him. I said, "How you doing? Is there something I can help you with?" And he extended his hand, I think, as if to shake my hand. And somehow his hands got around my throat. And I'm like, hey, man, you want to let go? And I put my hands up on his hands, but he literally had them around my throat. And I can remember a security officer standing like right behind him. And his face was gentle, like you could tell he had the confused look. But then he started to squeeze. And I did see his face change, his eyes squint, his lips got a little more pursed and firm. And you could see it change, and he started squeezing. And that's my brain started going, oh no. And I got the adrenaline dump. I'm like, oh no, what do I do? I tried pulling harder, and the security officer is trying to pull his other hand off, one of his arms off, and he's squeezing, and I'm starting to panic. And eventually he lets go, and you see the change in the demeanor back to calm. Now, in that situation where he is squeezing, I'm starting to see stars. Granted, he's not trying to do it on purpose. Would I have been justified in maybe doing a back slap to his, or like raking his face, or stomping on his foot? Would I have been justified in using self-defense in that situation? Man, that's up to each person in each scenario. I don't have a good answer for that. But what I would recommend, use the same questions, regardless of intent, because healthcare workers still do have the right to go home safe and uninjured at the end of their shift, regardless of who is perpetrating and committing the violence. You've got other things realistically, right? Like a headline of nurse strikes patient. It reads badly, even if it's legit, even if everything goes right. The caregiver who used justifiable self-defense, you can still lose your job. You could still be reported to the board of nursing, or if you're a doctor, you could be reported to your medical board. You could still face discipline. It'll hopefully all work out in the end. It's not going to keep you from some of these consequences that might happen. This whole episode is not about how to slap your patient. No, it's not about that. It's about if it does happen, when it does happen, how are we going to look at it? How are we going to do this fairly? We want policy to be fair. And if you want to learn about and hear all the problems with zero tolerance, especially in policies, go back to episode 5 of the Black Belt Nurse podcast and watch that. I lay it out. I lay out the history. I lay out all the problems with having zero tolerance. Essentially, we can't have it. But if you want the details, go back to episode 5 and watch that. Let's go back to the scenario in the beginning where the nurse responds to violence with violence. Best case, best outcome. They use the just culture process. Maybe they use the violent encounter decision guide. They already have it in place because the organization planned for this. The investigation is fair on both sides. The caregiver is cleared and supported. They're told of the investigation. There's no lawsuit. They're not fired. And the policy improves and the organization learns from the event. A middle case scenario might be they don't have a formal framework. They haven't thought about this ahead of time. And the caregiver gets put on paid administrative leave. Rumors start. People are like, I don't know what's going to happen. There's no investigation that's released. It's not shared. There's the secrecy. Somebody or even a caregiver to think of, hey, that could happen to me, and I see what happened to them. I don't know if I want to be here because they don't necessarily have my back if something goes sideways. And the worst case, the nurse is terminated. Months later, they sue the hospital for wrongful termination. There's depositions that are taken. There's documents that are reviewed. They'll ask for the investigation files. They'll ask for the video footage. They'll ask for policies. They'll ask for training. They'll ask for training records. And maybe it makes it to a jury. Maybe it doesn't. And maybe there's a settlement. It's costly. It's costly to the employer. It's costly to the organization. It's costly to the employee who is fired. It's disruptive to everything, to the culture, the psychological safety of the unit, and it's avoidable. Workplace violence is not a mystery. It's not a matter of if it's going to happen. It's a matter of when. So having a plan, including having a plan for when violence is responded to with violence, sometimes in a justifiable way, it's better to have a plan for that. So to bring this all home, what I want you to take away with this is that self-defense is legal public policy. Every state allows for self-defense. There's more case law now, specifically in Utah and Colorado, that is trending that yes, employees can use self-defense, even if the institution's policy prohibits it. Caregivers have the right to use it. And when we get into self-defense, reasonable force means that the threat has to be imminent, your response has to be proportionate, and your response of violence to violence stops the moment the threat actually does. And a fair investigation scrutinizes the organization at least as hard as it does the caregiver actions. And using a just culture type of investigatory model builds accountability without punishing for somebody using justifiable self-defense. It's a risk mitigation tool, and it can be a retention strategy. Just think, people talk. Like, look, this event happened to me. I felt it was handled fairly. Sure, I was put on paid administrative leave while the investigation was happening, which means I got paid while I was off. But everything worked out in the end. And they knew that they could improve on things, and they told me and they apologized to me. That would go a long way in retaining staff because it is expensive. So I want to thank you for listening. And again, I want to put the call out. I am piloting the Violent Encounters Decision Guide, which is a just culture-based investigatory tool to use after situations like this, especially a self-defense situation. I'm looking for people who want to take a look at it, who are willing to take some time to walk through it and give me some feedback before it goes live. So you can reach out to me through the website, through LinkedIn, or even Facebook, or you can email me at bill@blackbeltnurse.com. And one more time, because it matters, nothing in this episode is legal or medical advice. All right, that's episode 12. Thanks for tuning in to the Black Belt Violence Prevention Podcast. Don't forget to support the podcast by liking, subscribing, and sharing this episode. And if you're so inclined, you can donate to the podcast through buymeacoffee.com. There's a link in the show description. Until next time, stay safe, and I'll see you in the next episode.